Hello everyone, welcome to Vasomeditech Heal Your Heart EECP Treatment Center. Today in this video, we are going to discuss about a mineral called calcium, and it is important in prevention of heart disease. In our body, 99% of this calcium is either in your bone or teeth. So it is actually called a bone mineral because it is very important for bone development and its strength. But it is not only for bone, calcium is also utilized and it is important in other function of our body. For example, clotting. So if it doesn't clot, you may bleed to death. So for the blood to clot, calcium is one of the important component. And also your muscle contraction. So you got two types of muscle. One is a skeletal muscle and one is a myocardium, which is the heart muscles. So both the muscle require calcium for its contraction. So you would have heard many people complaining about cramps in the leg, and usually it is taken care by giving a calcium supplement. Similarly, heart muscle contraction also require calcium. So we know heart as a pump, it has to pump continuously throughout your life. So calcium is very essential for the heart to pump continuously without any trouble. Another important function of calcium is a nerve impulse conduction. So your nervous system conduct the impulse, and one of the important part where the nerve conduction is very important to our life is a heart rhythm. So the heart has to consistently go in a rhythmic fashion. So for this rhythm, calcium is very important. So people with high calcium or low calcium will have rhythm abnormality, which is called arrhythmia, which can also lead to death. So if calcium is so important, what is the source of calcium? So calcium is abundantly found in nature and also most of the food stuff we take. So most of the calcium, if you want to see which is high in calcium, milk, yogurt, cheese, we are high in calcium, and fish, especially sardines and salmon has high calcium. So if you look for the fruit, it's orange juice has a high calcium. And if you look for vegetable, cabbage and broccoli, so these are with also bread, these all have a high level of calcium. So usually our normal recommendation of 1000 to 1200 milligram of calcium is routinely covered by all this nutrition. So in women, they may need the calcium little bit more than men, probably around 1300. This is because postmenopausal women, they are more prone for osteoporosis, which is a bone problem which reduces strength of the bone. So they may be more prone for fracture. So many times you would see these postmenopausal women are supplemented with calcium. Now in this video, our most important thing is to find out the calcium role in patient with heart disease. Many patients in a routine consultation, they ask me whether I can take milk. So when I specifically asked what is the reason, they asked, they said because milk is high in calcium, so we want to avoid calcium. So the main reason behind their logic is many times when they do an angiogram or a CT angiogram or calcium scoring, they find high calcium in the coronary vessel. So when there is a high calcium, it is proposed they may have a high chance of getting heart attack and stroke and even death. So patients who are already have heart disease afraid to take calcium, so they think it may actually worsen the heart disease. Now is it fact or is it false? Now this was actually answered by a trial in 2016. So this is called MESA trial. It is a multi-ethnic study on atherosclerosis. So what they did is they took 5,000 patients and followed them up to 10 years. So before getting into the study, most of them did what we call as a calcium artery scoring. So this calcium artery scoring, they may able to identify and measure the amount of calcium in their coronary vessels. And these group of patients are categorized into two groups. So one is they take calcium through the natural source. So they will take food which is high in calcium so that they can able to make out the recommended requirement of calcium of 1000 or 1200 milligram per day. Another group is they are supplements. So they are actually based on supplements to attain their regular requirement. So when they followed up to 10 years and they repeat the CT coronary calcium scoring in most of the patients, they found out people who take calcium in a natural source, they have a reduced risk of heart disease. So they have a reduced chance of getting into heart problem. But the same is not true when they took the calcium from the supplements. So people who take lot of supplements, in fact, rather than having a benefit, they got a worsening of the calcium scoring. So the repeat calcium scoring shows there is an increased calcium in their coronary artery, and also they have higher trouble with heart problems. So this shows somehow your body is able to find out where your calcium is coming from. If it comes from a routine food, which is a natural source, it has a protective effect. But at the same time, if it comes from the source of supplements, then it has an opposite effect. This is called a paradox. Same calcium, but the effect depends upon where it comes from. So to make sure this is a true finding, many trials has been repeated after that, shows the same result. So the calcium it comes from supplements actually increases the risk. So let us look at the group of people who really take these calcium supplements. This is elderly group. So people with greater than 75 or 75 years old women who are usually prescribed by their orthopedic surgeon or a gastro or your gynecologist calcium supplement, because they say that is going to prevent your bone fracture and also can prevent cancer. So this is the main reason they give calcium for people with old age. And when they followed up them and then they looked at the cardiac incidence, in fact people who are taking this calcium did have a higher risk of heart disease. So it is surprising that whether calcium should be supplemented or not. This is also followed by two more important trials. In another trial, 60,000 patients, a woman, were followed up to 19 years, and they came up with the same reporting that if you take calcium supplement little over 1400 milligram per day, the required dose is around 100 to 1200. So if they exceed even 200 and above than the regular requirement, they did have a higher chances of heart attack. But now the question is, many patient comes and ask me, do we have to take calcium or we should not take calcium? Now some of the proponents of calcium, they come up with another study saying that if you take calcium, it does have an effect of reducing the cancer mortality or death because of cancer. Indeed, a study with 30,000 patients followed up to 7 years have showed people who are taking calcium supplement in fact has reduced risk of breast cancer and colorectal cancer. But now this is a paradox. So if you take high calcium, probably you may be able to reduce the risk of cancer, but at the same time your risk of heart disease goes high. So overall your mortality would be the same. So it is better not to supplement calcium until and unless if it is absolutely needed. So it is better to speak to your physician, and if you have a deficiency, then calcium can be supplemented. If you don't have deficiency, the best thing to prevent cancer death and also to prevent heart disease death is by having calcium from the natural source rather than from the supplements.
இருதய நோயாளிகளுக்கு வந்து பைபாஸ் சர்ஜரி, ஆஞ்சியோபிளாஸ்டி சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. இதற்கான மாற்று சிகிச்சை முறை வந்து EECP, Enhanced External Counter Pulsation, Heal Your Heart Vasomeritech EECP Treatment Center.